catheter. So I'm going to show up, dress uniform policy, check order form, hospital policy, identify patient, Jaguar Jones, 8/25/1963, 8/25/1963. I'm also going to note that he has an allergy to penicillin. I can also ask what that allergic reaction is like and if he has any allergies not noted on our forms or his allergy bracelet. Next, I'm going to explain the procedure to the patient. Mr. Jones, Mrs. Jones, today I'm going to be inserting and removing a catheter. I would then perform hand hygiene, raise the patient's bed to a comfortable working height and lower the side rail. I'm then going to help the patient into dorsal recumbent position, and I would then put on clean gloves, do perineal care to decrease the risk of infection, and then take off clean gloves. I'm then going to perform hand hygiene again and open catheter kit in between patient's legs. The outer bag can be used for trash. I'm now going to open the catheter wrapping away from me first. And now I'm going to don sterile gloves. Now I'm going to remove the waterproof sterile pad and place it face down between the patient's legs. I'm now going to remove the inner tray and move it closer to the patient. At this point, I'm going to place lubricant into my tray, open my cleansing swabs, remove the plastic wrap from my catheter, and go ahead and attach my saline syringe. At this point, I'm going to use my non-dominant hand to spread, and I will provide perineal care. The first swab will be used on the right side, going from top to bottom. The second swab on the opposite side, from top to bottom. And lastly, in the middle, from top to bottom. Now that I've completed perineal care, I'm going to lubricate the catheter. I'm I'm going to lubricate the first 1 to 2 inches for females and 5 to 7 inches for males. Now I will inform the patient that I'm going to insert the catheter, and they should bear down as if they were going to void. For women, insert the catheter until urine return, and for men, all the way until bifurcation. When urine is returned, advance 1 to 2 more inches. Once inserted, press the saline solution slowly to inflate the balloon. Do not release the pressure on the syringe. While keeping pressure on the syringe, remove it from the catheter. Now, I will use a stat lock device to secure the catheter onto the patient. I will begin by unlocking the device and placing the catheter within it. Once the device is locked, we'll use an alcohol swab to prepare the patient's thigh, remove the adhesives from the stat lock, and secure it on the patient's thigh. From here, the catheter bag should be secured lower than the level of the bladder of the patient, but not on the bed rails, and it is important to make sure that there are no large loops in the tubing so kinking does not take place. So I'm going to hook mine. From here, I would remove my supplies. And doff sterile gloves, using glove to glove and skin to skin. From here, I will assess patient comfort, allow them to lay in a comfortable position, and lower their bed completely and raise their rails. From here, I would perform hand hygiene and move on to documentation. In documentation, I would list the type of catheter, the color, odor, and amount of urination, the patient tolerance or reaction, and if there is any cloudiness to the urine. Next, I'm going to show how to remove the catheter. So I'm going to begin by coming in again fully dressed. I would check policy, identification, and allergies. I'm going to don clean gloves and goggles. Okay, once I have on clean gloves, I'm going to raise the patient's bed, lower the side rail. I'm going to place a waterproof pad down. I'm then going to remove the catheter from the stat lock. And before removing the catheter, I would drain the bag. So the way you do that is remove the tubing, you would unclamp it to drain, clamp it back, and return the tubing back into the bag. I do need my syringe. So first I will place the syringe, well, I will move the syringe back and forth, allowing air to flow, and I will draw 0.5 milliliter. I'll then connect the syringe to the catheter and allow the water to flow out of the balloon using only gravity. Once it appears that it has finished, let the patient know you are about to remove the catheter. Once removed, wrap in the waterproof pad and dispose. And you can now remove the stat lock from the patient's leg. Once the catheter has been removed, you will need to provide parenteral care on the patient again. After this, allow the patient, or assist the patient to a comfortable laying position. They can come out of dorsal recumbent position, and you will lower the bed and raise the side rail. I will take off clean gloves and move on to documentation. Again, I will document the color, odor, and amount of urine, the amount of return from the balloon, the patient tolerance, and I will educate the patient on side effects of urinary tract infections, such as discoloration of urine in a pink, red, or cola-like color, painful or small urinations, frequent or small urinations, pelvic pain, odor, and burning sensation when urinating. After educating the patient, I move on to documentation and document that you did educate them. Perform hand hygiene before documentation. And that completes catheters.